It's a complex issue. What do we do for our friends, family, neighbors, fellow Georgians with complex mental health behavioral needs? It is an issue that our senior investigative reporter, Rebecca Lindstrom, has investigated extensively over the years, and she has some new reporting on this morning. Rebecca?
Even identifying the group that we're talking about takes a lot of words, right?
Yeah.
And so when you think of it in that way, you begin to realize if that's how hard it is to describe the population we're talking about, how much more difficult must it be to actually provide the care and treatment that they need. And this issue gets even more confusing because you've got DFACS, which helps the children, for the most part, who have these really complicated medical conditions. And really what we're talking about are people who have a combination of one of three things: autism, mental health disorders, and developmental disabilities. So you get into a lot of specialties and specialty training that's going to be needed to kind of reach someone who is nonverbal or might be 22 years old but has severe autism, and behaviors are the only way they've ever known how to react. Right. So you've got DFACS who's doing the children, you've got DBHDD, the Department of Behavioral Health and Developmental Disabilities, who is primarily trying to find placement for the adults. And you have DCH, the Department of Community Health, which then operates Medicaid and is supposed to be holding these insurers accountable for providing, access to the care that's needed. And on top of all of that, because the care just doesn't exist in Georgia and isn't being provided, you have a federal lawsuit that's looking at Georgia saying, well, it is a lawsuit by several nonprofit groups that is being held in federal court. I should say it that way. The federal government has joined in on it as well, though. So you've got a lot of conversation around this topic. And really at the end of the day, what we're talking about is people who are being, in many ways, abandoned to hospitals, abandoned at these residential treatment facilities, either abandoned by parents that just don't know what else to do, or some feel abandoned by the state because it has no way to care or treat them. And to sort of just sum up really what we're talking about, I'd love to share with you a story that I did that really highlights one family and their struggle. I asked Kelly Lewis for some pictures of her boys, Ahav and Analil. She sent these playful moments and creative drawings.
That was probably a subconscious move to send you the good times.
She believes there'd be more good times if the boys had received the right kind of care sooner.
That's one of those that you try not to dwell on because you get angry.
Lewis and I talked by Zoom because after 20 years of living in Georgia, this supermom has moved out of state, fighting to find treatment for her sons. They both have autism and severe mental health disorders. It is a combination Georgia's Medicaid system struggles to treat, but Lewis doesn't understand why.
This hospital, this program that my son was sent to that has fully integrated care, he was placed there by DCH, by Georgia Department of Community Health, which means Georgia is completely aware that there's a gap and they know a place that fills the gap.
That's why the Georgia Advocacy Office, or GAO, is working with a team of national organizations and local attorneys to file a class action lawsuit in federal court representing more than 40,000 children on Medicaid. The GAO referenced 11 Alive's multi-year series Keeping in its letter to the state as evidence of the need for reform. The series focused on children with complex medical needs, fighting a system that seemed intentionally ill-equipped to help.
So it's not going to be difficult to find evidence. They've written reports, they've studied, they've evaluated, they've come up with solutions and not implemented things.
The GAO alleges some medically necessary services are not covered or exist only on paper.
Georgia has been doing what they're doing for a very long time. We've written letters, we've talked to people, we've tried, and we're really left with no other solution at this point. So here we go.
Lewis says her sons have been hospitalized 65 times, repeatedly treating only surface issues. Still, she says there are virtually no options for care when they come back home. She remembers calling to confirm an appointment set up by a mental hospital treating her son.
They've never heard of us. They don't treat children. They were basically a drug and alcohol treatment center. So now you gave me a fake discharge appointment.
But it's not like the other facilities. You hear what I'm saying? It's actually going to give me some help. Yeah.
Lewis has asked us not to say where they are living now, but Ahav says the new hospital in this new state has already given them new hope.
These are highly creative, beautiful, loving, caring, funny, silly little boys that just happen to have mental illness.
Well, your heart breaks for the decision, hard decision she's had to make in her lifetime for her family. What's happening today with this issue?
Yeah, this is on the forefront today because while we did all of that reporting in the past and the state did do the Mental Health Parity Act about 3 years ago, really addressing this, lawmakers have realized through families still reaching out to them that big gaps remain. And so there was a study committee going into session to try to look at where those gaps still exist and some recommendations that are coming out through the appropriations meetings that are taking place this week and next week on, how to address those concerns, as well as legislation that's coming out of that. And so Commissioner Kevin Tanner told lawmakers that, at some point in time, we're going to need to think about creating our own psychiatric residential treatment facility and step-down service pipeline if we're really going to address this issue. I spoke with one mom who, her son, paid for by us as taxpayers because there was no resource here in our state, was sent to Texas at a 3-month stabilization center. The problem is he's now been there 2 years. And what you find is when you're in a hospital longer than you really need to be, your behaviors just begin to regress. And a lot of times these children or these adults are leaving with more problems than they went there with, on top of all the costs and expenses of her flying out multiple times a month in order to visit her son. And so they've been trying to figure out how to discharge him back to Georgia, but we just don't have these services. And so we know that Augusta has been able to build 8 beds that sort of target the adult population. They've got about 12 beds, Commissioner Tanner is reporting now, that are being built in the Macon area. They're looking throughout the state to see where else. But, even if you think about that, that's 12,
20
8,
beds?
that's 20.
For statewide care?
For statewide care. And so lawmakers really are going to have to figure out what to do. And then this all plays into what we've been hearing about defects and the $85 million budget shortfall, which now I guess is only about $40 million, but that's still a lot of money. And in Commissioner Brose's own testimony, she said this is also the population that is costing us the most money because there's so much needs that they have, and we just don't have the right ways to treat them here in Georgia. So we're spending a lot of money to just sort of stay on the hamster wheel.
All right, Rebecca, it's a great example of giving voice to the voiceless with these stories, so thank you for staying on this topic.
Absolutely.